Okay, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Saya Ahmad Khairul bin Shah Rizal dan ni group mate saya, Muhammad Nabil Ridwan bin Muhammad Dahlan, Tiswari Naidu anak perempuan Radha Krishnan, Ummu Salmah binti Saiful Amran dan Ernie Nurismawani binti Imam Sunario. Jadi group kami akan membentangkan tentang benzin. So contents of our presentation, first one is introduction, chemical structure and properties which be explained by me. Routes of exposure will be explained by Nabil. Mechanisms will be explained by Ratis. Clinical effect by Ummu Salmah and management of poisoning by Ernie Nurismawani. Jadi, proceed dengan introduction. Okay, benzene. Benzene is an organic chemical compound with the molecular formula C6H6. Organic compound kat sini bermaksud compound which contains carbon and hydrogen which are covalently bonded. And benzene is used mainly as a starting material in making other chemicals, including plastics, lubricants, rubbers, dyes, detergents, drugs, and pesticides. Benzene is known to cause cancer, in other term carcinogenic, based on evidence from studies in both people and lab animals. The link between benzene and cancer has largely focused on leukemia, cancer of blood cell, and other cancers of blood cells. Benzene is immiscible in water, means insoluble in water but soluble in organic solvent. Organic solvent kat sini is a carbon based substance. So carbon dengan carbon dia boleh terima. Sebab tu dia boleh soluble dalam organic solvent. Contoh ni ialah toluene, kita ada tetrachloroethane dan juga ethanol. Benzene is a colorless liquid and has aromatic odor. Bau macam gas tu. And it is volatile. Volatile ni meruap. Maksudnya bila kita letak dalam beaker ataupun bekas, dia akan bertukar jadi vapor dalam masa yang cepat, from liquid to vapor. It is highly inflammable and burns with a sooty flame. Sooty flame ni asap yang warna hitam tu. Sebab dia carbon, so product of combustion dia ada soot asap hitam ni. So ni yang saya kata tadi pasal starting material for manufacturing other products. Okay, the first one macam kita boleh tengok ialah polystyrene. Polystyrene mainly used dalam food packaging. Lepas tu yang kedua ialah bisphenol A. Bisphenol A macam dalam kelas Prof Fatah, dia ada mention sangat crucial material untuk buat plastik. So plastic wear sama lah. Lepas tu kita ada resins. Resins ni dalam printing ink, dawat printing tu dia ada resin. Sebab apa? Resins ni dia punya property dia allow substance tu ataupun ink tu untuk bind together to the printed surface. Sebab tu ada ink kat kertas. Kalau tak ada resins ni maksudnya dia takkan ada kat atas kertas tu, dia takkan melekat. Lepas tu kita ada nylon 66 which is dalam thermoplastic, plastik yang kita boleh bengkok, kita boleh mold at certain elevated temperature. Lepas tu kita ada nylon 6. Nylon 6 ni dalam textile industry such as carpets, parachute dengan rope. Dan lastly kita ada chlorobenzene. So ini ialah contoh drugs that contain a benzene ring. The first one is Zoloft. Zoloft is from a class of antidepressant of selective serotonin reuptake inhibitor class. So it's a psychotherapeutic drug for depression and panic disorder. The second one is Valium. Valium is a benzodiazepine used as a sedative. The third one is Novocaine. Novocaine is an anesthetic to cause numb to certain part of the body. And then next kita ada Veracet. It's an antiretroviral drug used in treatment of HIV. Next kita ada Viagra. Viagra is a class of phosphodiesterase inhibitor used to treat erectile dysfunction. And then lastly kita ada Claritin. Claritin is an antihistamine drug. Antihistamine means involve allergy lah. Okay, chemical structure of benzene. This is the structure of benzene as we know it. Molecular formula C6H6. Another name for benzene we have benzol, cyclohexatriene. and phenyl hydride. Molecular weight 78.11 gram per mole. And we have three known structure: Lewis structure, Kekule structure, and resonance structure. Lewis structure is basically the simplest structure. It shows how many electron or how electron are arranged around individual atom in a molecule. So dalam ni elektron tu dalam bentuk line. It is between carbon and hydrogen and carbon as well. Then we have Kekule structure. Kekule structure is a Lewis structure which bonded electron pairs are shown in lines. So kat situ line tu ialah elektron. Last sekali ialah resonance structure. Resonance structure yang dalam slide ni basically ialah resonance hybrid. It's an intermediate structure between two resonance structure of benzene. Tak apa, kita akan terangkan lebih lanjut dalam slide resonance sekejap lagi. So ni ialah summary of chemical property for benzene and physical property of benzene. For chemical properties, kita ada nitration, bromination, chlorination, sulfonation, which is the addition of sulfonic acid, and then alkylation. Alkylation is transfer of alkyl group or alkyl group. And then we have acylation. Acylation is addition of acyl group. And then we have deuteration. Deuteration is a replacement of normal hydrogen with heavy isotope deuterium. Then we have physical property: color, order, boiling point, solubility, and density. Next. Okay, aromaticity of benzene. So what is aromaticity of benzene? So basically aromaticity ni is a property of benzene which provide special stability. Tapi in order to reach aromaticity, it has to possess 4 specific qualities below. So the first one is pi bonds must lie within cyclic structure. Each atom in the cycle must have p orbital, forming p orbital loop. P orbital in the loop must overlap and lie within same plane and follow Huckel's rule. Okay, yang ABCD ni basically kita belajar dalam metrik ataupun asasi. Saya tak nak go into detail kat sini. Tapi kat sini contoh macam kita nak prove aromaticity of benzene. Okay, the first one is, do pi bonds lie within cyclic structure? If yes, then proceed with the second step. Does each atom have p orbital? Yes. Proceed with the next step. Do all p orbitals overlap and lie within same plane? Yes. And the lastly is, does the molecule follow Huckel's rule? If the molecule possess all these 4 qualities below, then it is reached aromaticity. Next ialah resonance. Resonance ni dalam kata lain ialah electron delocalization in a molecule. Maksudnya elektron tu tak stay setempat, dia sentiasa bergerak. It's a delocalization which benzene where the bonding cannot be explained by one single Lewis structure. So satu Lewis structure tu tak cukup untuk menerangkan resonance dalam benzene. Sebab tu kita ada resonance hybrid tadi. Resonance hybrid tu basically intermediate structure between two resonance structure. Macam kita tengok dalam diagram bawah ni, nampak tak double bond dia? Yang ni dengan yang sebelah kanan ni beza. Dia macam shift, ada shifting kat situ. So dia result in different pattern. Resonance ni they provide extra stability due to electron delocalization, and consequently and aromatic rings have resonance due to cycling double bond. Okay, aromatic molecules must have resonance, but not all molecules with resonance structures are aromatic. This is important lah. Macam in order for that molecules to have aromaticity, it has to possess all 4 qualities dalam previous slide. Tapi tak semua aromatic molecules ialah semua aromatic molecules are resonance, but not molecules that are resonance aromatic. So itu saja daripada saya. Saya akan serahkan next presentation kepada rakan saya Nabil dalam penerangan route of exposure of benzene. Terima kasih.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Nabil Ridwan. I will continue this presentation by explaining routes of exposure. I think most of us did this, smelling the benzene at the gas station through the window, it is inappropriate, but we call it dirty pleasure. It is not good for our health actually. Okay, so basically there are three different type of exposure for benzene, which is inhalation, oral, and dermal through our skin. Alright, next. For inhalation, short-term inhalation can cause drowsiness, dizziness, and headache. This is not a very severe symptom. We can still cure this one. But for long-term or chronic, may cause blood disorder, distal neuropathy, and memory loss. So basically, on your right side, there is a picture showing or explaining how benzene can affect our health. Firstly, benzene enter our body through the nose and enter the lungs. In the lungs, benzene passes into the blood, and then benzene in the blood goes to blood circulatory system. From blood from circulatory system transported into the liver, and then in the liver, benzene converted into phenol. Alright, from phenol form, it can pass through our bone marrow and affect our stem cell, which can cause or underproduction or overproduction, which is basically a cancer. Next, oral or ingestion of high concentration of benzene can cause death and central nervous system depression. Next, lastly, dermal, through our skin. It can be absorbed through the skin due to leakage from underground gasoline storage tanks, resulting contamination of well water. This day, I don't think there's still people using well water for clean water sources. And gas station basically located at designated area, and that is for safety reason, I think. Next, benzene contaminated tap water can be exposed during showering, bathing, or cooking, resulting in redness and blister. So this symptom can appear at our skin if the water is contaminated with benzene. Alright, that's all for my part. I will pass this presentation.
Thank you, Nabil. I am Ratis, and now I would like to explain on my part, which is regarding the mechanism of benzene toxicity. The benzene that has been entered into the body will undergo oxidative metabolism in the liver, and this will lead to the formation of its first metabolite, which is the benzene oxide. This first metabolite then will undergo metabolism, yielding to free radicals and many other metabolites. Not only that, this benzene oxide will form many other dangerous metabolites such as hydroquinone, phenol, catechol, and benzoquinone. These dangerous metabolite of the benzene and the free radicals formed are considered as carcinogenic agent, as they can undergo other mechanisms that can cause DNA and chromosomal damages, including oncogene activation. As you can see in the figure over here, these benzene metabolites and the ROS can cause damages, especially focusing on the DNA or the chromosome of a cell. Since the DNA and the chromosome of the cells are affected by these benzene metabolite and the ROS, This will lead major negative effect on the cell, especially in terms of cell signaling pathway, gene expression profile, and also alters many normal function of the cell. This benzene also targets many vital systems and including important organs such as lung, heart, and brain. But then it causes non-cancerous effects such as neurological abnormalities and reproductive dysfunction. But then this benzene is primarily toxic or focuses more on the blood forming organ, which is the bone marrow. The benzene metabolites and the ROS, which is the free radical, allows the bone marrow to be depressed, causing malfunction of the bone marrow, and this affects multiple classes of hematopoietic cells, ranging from immature blood cells to mature blood cells. Since the function of this bone marrow has been altered, this can also lead to pancytopenia, which means the reduction in the number of all types of blood cells. Not only that, the benzene's metabolites can cause cancerous effect, especially on the blood cells, which can lead to hematological malignancies such as non-Hodgkin lymphoma and leukemia. That's all from my part. Next, I'll pass the presentation to Umul Salma. Thank you.
So I will continue the presentation with the clinical effects of benzene. The clinical effects of benzene can be divided into two types of exposure. First exposure is the immediate exposure, where you have immediate contact with the benzene in such routes as inhalation, ingestion, or skin contact. The second type of exposure is the long-term exposure, commonly associated with the workplace exposure. Immediate exposure: as you have immediate contact with the benzene, you will feel drowsiness, dizziness, having rapid or irregular heartbeat, headache, vomit or vomiting sensation, unconscious, lung irritation, eye irritation, stomach irritation. At such case, if you have very high levels benzene contact, it can cause death. Moving on to the second type of exposure, which is the long-term exposure. Long-term exposure means we have contact with the benzene, exposed with the benzene for more than 1 year. The major effect of benzene from long-term exposure is on the blood. The long-term exposure of benzene cause harmful effects on the bone marrow and cause the reduction of RBC production, which will lead to anemia and also cause excessive bleeding. The harmful effects of benzene on bone marrow also increase the chances of getting infection. In some women who have exposed to the benzene for long term will have irregular menstrual periods and a decrease in the size of their ovaries. Next, animal studies have shown low birth weights, delayed bone formation, bone marrow damage when the pregnant animals were used in the benzene experiment. Next, the Department of Health and Human Services determined the benzene can cause cancer in humans, so the benzene is carcinogen. High levels of benzene exposure for long term can cause leukemia and other blood forming organ cancers. So that's all from me. I will pass the presentation to Ernie.
Thank you, Salma. So I'm Ernie. I will continue the presentation with management of poison. So before we manage or give treatment, we have to know the routes of exposure. So there are 3 routes of exposure, which are swallow, breathe in, and touch. So this reminds that there is no antidote for benzene poisoning. So it is actually the treatment and management we give is to avoid any further exposure or any worse condition. And for treatment and management, it is give according to the type of exposure, which are acute and chronic. So I will explain first on acute exposure. So for early treatment, it is usually supportive and symptomatic. And very first consideration, remove the patient from the exposure immediately to avoid any further exposure, and remove the contaminated clothes or shoes immediately from the patient to avoid any skin contact. After that, for the skin or eyes that has contacted with the liquid benzene, wash immediately the exposed skin with soap and copious water immediately. And for the eyes, irrigate the eyes with the running water for 3 to 5 minutes or until the irritation ceases. And after that, for inhalation, evaluate respiration function and pulse and ensure that the patient has no any obstructed airways. And if the patient has difficulty or shortness of breath, start administration of oxygen. And if the breath has ceased, provide artificial respiration. There are few type of artificial respiration, and the most famous one is cardiopulmonary resuscitation, or also known as CPR. So there is advice from American Heart Association for untrained saver or trained saver that but not really confident with their ability. They can just do hands only CPR, which not include any rescue breathing. So they just do uninterrupted chest compression for 100 to 100 a minute until the paramedic comes. And for trained saver, they follow the step of a CPR by check the pulse and breathing first. So if there is no breathing or pulse in 10 seconds, begin the chest compression and start CPR with 30 chest compression before giving to rescue breathing. After that, if the patient cough or have difficulty or shortness of breath, start evaluate for tract irritation or inflammation, because there is possible for bronchitis, which is inflammation of the large airways, or pneumonia, which is inflammatory lung disease. After that, monitor for the low BP, abnormal heart rate, and any reduced respiratory function. So if there is respiratory compromise, secure the airways and respiration and insert the tube within the trachea. And if there is shock or low BP, begin the IV fluid administration. And if the heart rate is abnormal, avoid the epinephrine, because there is possible of sensitization of heart muscle that can lead to heart attack. And lastly is, if the patient has seizure, administer the benzodiazepine. And lastly, for acute exposure is ingestion. Like the inhalation, ensure the patient has no any obstructed airways. And remember, do not induce the vomiting, because it can block the inhalation airways. And after that, take the measure to avoid stomach content being taken to the lung by placing the patient on their side, and administer activated charcoal, because activated charcoal has limited ability to decrease gastrointestinal absorption of benzene. And soda can and straw may be assistance when offered the charcoal to child. And after that, once the airway is secured, consider using a soft, flexible nasogastric tube to aspirate the stomach content. So next is chronic exposure, same as acute exposure. Very first consideration is remove the patient from the source of exposure immediately. And after that, the patient has to do hematologist test, because benzene induces depression of blood elements, but generally it will reverse after the exposure is terminated. But if the hematologic result do not return to normal, the patient should consult hematologist and oncologist. And lastly, chemotherapy and bone marrow transplant are therapeutic options for leukemia and aplastic anemia respectively, because what has been said before, the benzene induces the depression of blood elements that can lead to leukemia and aplastic anemia. So that's all from us. Thank you.